Arguing for the end of adult marijuana prohibition is easy because we have facts, science, reason, compassion, evidence, truth, and logic on our side. It is even easier when researchers catalog it all for us. Learn how to gather the facts on marijuana use, arrests, seizures, rehabs, drug tests, and more in this edition of Drug War Data Mining.
Welcome back, everyone. 22 and a half after the hour, and we're continuing on yesterday's lesson where we're trying to tease out stats on the age rates of people that use marijuana monthly in medical versus non-medical states. And some of the variables, we were going back to the National Survey on Drug Use and Health, the 2-year RDAS, and I'll paste that into the chat room if anyone wants to follow along. And you can always email me if you want the information or the websites or the links on how to do this. But again, the RDAS is the data on the states and their drug use, and there are a number of variables all available through the left-hand side, and you can go in there and open and explore with them. You must put in a row variable, and that's usually how I figure out exactly how these variables are going to work. We're going to start with a variable called cat age, CATAG2, and that is an age category with 3 different levels. Let me maximize the screen there. Age category with 3 different levels. Running that table will give you an idea of what the 3 levels of ages are. 12 to 17 years old, 18 to 25 years old, and 26 or older. And in this survey, 10% of the people in the survey are 12 to 17, 13% are 18 to 25, and 76.6% of the people in the survey are 26 and older. So that's already given us the start we need. Now, we can also figure out whether or not a state has medical marijuana use. This is broken down by state. A variable called MedMJ use will tell us whether or not your state has been approved for medical marijuana. Running that table is going to tell us that within the data, we have 13.7% of 12 to 17-year-olds surveyed in the medical marijuana states versus 8.3% of 12 to 17-year-olds surveyed in the non-medical marijuana states. But again, this is everyone surveyed. This isn't asking whether or not they've used marijuana. We're going to break this down by selecting a selection filter. There's a variable called IRMJRC, which is your recency of marijuana use. It'll tell you within 30 days, within a year, over a year, or none. And in yesterday's lesson, we learned that number 1 for IRMJRC is the people that have used marijuana within the month. So running that gives us a table that we can see that in medical marijuana states, 14% of the people that used marijuana within the month are between the ages of 12 and 17, 10% in the non-medical marijuana states. And that would seem bad at this point. It would seem like, oh no, medical marijuana states have more kids that use marijuana. But it's important to look at this as a trend. And to find the trend, we can use a control variable. That's a variable that gives us multiple pages. And in this case, we're going to use year pair indicator. That tells us which of these years, 2002, 4, 6, 8, or 10, we're getting variables for. We run that table. This is going to break it down into the 5 different years, and I'm going to suppress the bar chart here on the side just to make it easier to scroll through. And as we scroll through this, we find that when we started in 2002, 17% of teenagers were using marijuana in the medical marijuana states. Again, this is monthly, versus 11.4% in the non-medical states. But that's in 2002. Look what's happened to the trend. In 2004, medical states are down to 16.9. Then 15.2 in 2006, then 12.0 in 2008, down to 11.3 by the time we get to 2010. So we are now down in the medical marijuana states in teen usage to where the non-medical states were 10 years ago. Regulation is working. It's bringing down the age of marijuana users in the medical marijuana states. And again, looking at this, 11.3. And in the medical states, 54% of monthly users are over age 26 versus 52% in the non-medical marijuana states. More older adults use marijuana monthly in the medical marijuana states than they do in the non-medical marijuana states. And for more fun, you can break this down a different way. Instead of using medical marijuana use as the column, we can put the IRMJRC back up there. And we can pick this out by every particular state. For example, if I pick state 41, that happens to be the state of Oregon, I can get this data on marijuana usage just for my state of Oregon, showing that marijuana use for 12 to 17-year-olds was 8.4% 30-day use in 2002. But if we get down to 2010, it's down to 7.6% in Oregon. So the longer medical marijuana has been in Oregon, the fewer young kids